Students, let's start. And as you know, today's topic is listening. We'll be looking into the tips and strategies. And let's see how we can crack it easily and enjoy doing it. Without doing hard work, we always stand for smart work and patience. Have patience and do smart work. So hope you are ready for the journey. Let's jump into the session.
Good evening, Father.
Hi, good evening, Father.
Good evening, Father.
Good evening.
Ready to rock?
Yes.
Yes, Father.
Yes, Father.
Yeah, today is part B, right?
Yes.
Yes, Father.
Yes. So we will straight away jump into it. So welcome back to Edu Skills, Learning Made Easy. Our mission is to make you fall in love with OET. And today we are traveling together to understand listening part B. We'll have dialogue as well as monologues, as you know. We'll have easy tricks and tips for you. And if you're watching this on YouTube, kindly consider subscribing our channel, Edu Skills YouTube channel. And also, if you like our work, give us a thumbs up. And please do share it to your contacts so that we may go to many more who are struggling to crack OET. Okay, so OET 2.0 Occupational English Test, Listening Part B, Key Skills. Listening key skills, as usually I say, never ever target 350 B, target 450 to 500 A grade so that you are safe, at least with 400 and plus. Listening part B, you know, almost like you have almost 2 minutes each for each question, dialogues or monologues. And maybe you'll have to complete it within 10 minutes, which is an easy task, which I'll let you know now. 3 options MCQs and 10 minutes time. And the question types, you know, it's a gist. You have to understand the gist. General meaning of the text you should understand. And I'll be explaining to you how easily you can understand the general meaning. And gist means who is discussing. You should understand who is discussing or explaining or speaking, who is the discussion partner, or what are they discussing. These things, like there will be doctors, hospital managers, nurses, anyone. Then also you should listen for the detail. What is the concern? What is the issue, the symptom, reason, solution? So what is the main problem? That also you have to listen, which will be there in the very beginning of the audio. And third one is course of action. What is the solution or course of action taken? What is to be done by nurse, doctor, or manager? These are the things basically in each of these 6 audios. And listening for, as you know, context, main idea, purpose, opinion, and attitude. So you'll be listening for the context. What is the context? In which context are these people discussing something, or someone is explaining in a monologue? And the main idea, you should be able to understand the gist or the main idea and purpose of the conversation or the monologue or the dialogue. So you should be able to identify that. Opinion of the speaker and the attitude of the speaker. These are the basic things you need to understand. And all these of the speakers and details I am not going into now. All these things, as you know, the gist, the strategies you'll have to look into in all the subtests of OET. So, and again, you know, it is question, answer options, then listen, audio, qual method we call it. That's also I'm not going to explain to you. We have in the previous videos uploaded all these details, but just bring into your mind. It should be a question first, then you have to identify the topic in the answer and the stem words in the question, then identify the structure of the conversation, nature of the topic, and focus of the audio or the conversation. Listening strategies focus on the main idea of the communication. As you know, I have explained earlier about the topic, sentence, keyword, which will help you to understand what is the main idea, very beginning of the conversation. Pay attention to signal words used to emphasize key points or show relationship between ideas. Okay, keywords like I said, now the contrast words or the relationship words or comparison words, all those things. Synonyms, rule out incorrect answers, you know, elimination strategies, select the correct answer. And pre-listening strategies, you have 15 seconds per question. I said golden seconds. Okay, here also it said golden seconds, 15 seconds. That is pre-listening strategies. What should you do before listening? Look at the context. Immediately in the question booklet, you have the context given at the very beginning of the question. So look at the context, notice the structure of the conversation, read the question stems carefully, the main question stems, read the options and notice the differences between the options. Underline keywords, verbs, adjectives, nouns, etc. in the question and answer options. So the context.
You hear a dentist discussing booking problems with her receptionist.
Okay, this is how they introduce the whole concept, that you should listen to these instructions and understand the context. And notice the structure or the sequence. Listen for the keywords, signal words, key points, paragraph structure. Okay, if you don't get the answer immediately, skip and go. As I say normally, you can come back later. Okay. Tip 1, focus of each text idea or the topic sentence or the point. As I said, definition, or it will start with a definition or a description each conversation. Then they will explain it. The topic idea will be explained. Then they will give some examples or illustrations about the main idea. They might give us conclusion also. That's the common structure. Okay, so you have a point in the beginning. When they start speaking, they will tell you what is the issue, main issue or the main key point. Then they will explain what is the problem. Then the reasons will be discussed. Okay, this is how they give the structure. If reasons, under reasons, 1, 2, or 3 reasons will be given, and in the question you will be asked to identify which is the correct reason. Okay, this is how they mention point. A problem will be given, then what is the reasons for the problem, then you will have reasons or solutions, whatever, but the structure will be same. Underline keywords, just listen to this. Now, could somebody read this question for me?
Underline keywords. You hear 2 OET aspirants talking about today's Zoom session for OET aspirants. They think that few nurses have shown interest because there are so many sessions on offer. B, they feel it's not relevant to them. C, it hasn't been publicized enough.
Now, this is the question, okay? And this is our present situation. Today's, just I have taken a sample. This is not the 27th question, today's part B. But now, they think that few nurses have shown interest because few means no one.
No one.
Yeah. If you make it a few, it becomes some of them. There are so many sessions on offer. There are very few participants yesterday and day before yesterday. That was our issue, right? So there are so many sessions. What are the reasons? Reasons. One is there are so many sessions on offer. They feel it's not relevant to them. It hasn't been publicized enough, or it means you have not posted the notice in all the platforms, something of that sort. It's not, I'm just taking it as an example, not the fact. So I told you, reason first, second, and third, and you'll be asked to choose one reason. So you have to understand this structure. Now you will listen to the audio. Just listen, okay? You have known these 3 options, Once again, I'm telling you, there are so many sessions on offer. Why very few enter or no one enters the Zoom session? One is, there are so many sessions on offer. If you don't attend morning one, evening, there is one, or again, there is a repeat session, something of that sort. Second one, they feel it's not relevant to them. They feel it's not relevant to them because they are studying in different institutes. It hasn't been publicized enough, means we haven't posted the notice in all the empowering groups, or we haven't published it in the main platform. So just listen to the audio and try to understand what is the reason, which is the correct option.
The registration for the OET Zoom session for nurses has been disappointing, hasn't it?
It has, but I am not exactly sure why, because everyone seems to know about the session tomorrow. And we asked Father it to be changed from morning session to evening session to make it easier for nurses to be released from their wards. But apparently, that was not possible because Father has some other schedule in the evening.
Yeah, I'm not convinced timing of the session was the problem anyway. I think once OET aspirants become aware of the real benefits of Father's sessions and how it helps them, there might be more interest.
Certainly, it is very important to attend Father's live sessions, even if the OET aspirant themselves don't actually realize it at present.
Now somebody can read this. This is the audio, script of the audio. We'll just read and understand.
Krishna, the registration for the OET Zoom session for nurses has been disappointing, hasn't it? It has, but I'm not exactly sure why. Because everyone seems to know about the session tomorrow. And we asked Father it to be changed from morning session to evening session to make it easier for nurses to be released from their wards. But apparently that wasn't possible because Father has some other schedule in the evening. Krishna, yeah, I'm not convinced timing of the session was the problem anyway. I think once OET aspirants become aware of the real benefits of father's sessions and how it helps them, there might be more interest. Yeah, certainly. It's very important to attend father's live sessions, even if the OET aspirants themselves don't actually realize it at present.
Now, what is the answer
Yes.
and why is the answer? Which is the correct answer?
B is the
B is
answer.
the answer.
They feel it's not relevant to them. Okay, but other things are also mentioned there, right? Yes, but I am not exactly sure why, because there everyone seems to know about the session tomorrow, which means already publicized, right? They are not saying it directly, but it means so. And but apparently that wasn't possibly because father has some other schedule, and changing the schedule was not possible. A contrast word is this. Then I think once OET aspirants become aware of, so what is the criteria used here? I think, what does it speak? I think opinion. Opinion of the speaker. That is the opinion of the speaker. So the answer will be the opinion of the speaker. And there might be more interest. So that also tells this opinion is stressed. So might be more scale and modal verb is used to ascertain the option. Okay, this is just for example. You hear two OET aspirants talking about today's Zoom session for OET aspirants. They think that few nurses have shown interest because that is the question, and this is the text we had script audio. Okay, OET aspirants become aware of the real benefits of other sessions and how it helps them. There might be more interest. See, this is not a text. Actually, we created a text with the present situation, but to make you feel how the opinion questions are framed. Okay, here also in the question, when they say they think, it's an opinion they are asking for, right? The question itself says they think that few nurses have shown interest because they think, because now Krishna is giving the opinion at the same time. XY said, yeah, certainly it's very important to. She agrees with that. So that's why it is the opinion of both of them. They think that. That's why assessing the question and answer options and finding out the stem words is very, very important to understand. So this is they think speaks about the opinion, and few is the scale there because says ask for a reason. Okay, and negative meaning, they feel it is not relevant to them. It is not said directly in the question here, but then it says, I think OET aspirants become aware of the real benefits of other session, but that is given here in the answer option as they feel it's not relevant to them. It's given in a negative sense, modal verb being to ascertain and certainly. That says it's the opinion of both. Might speaks about opinion, more speaks about comparison and a scale. Okay, just to give you an idea, the structure again, point, problem, reasons discussed, and 1, 2, 3 reasons were there. We selected the second reason. So now dialogue structure is this. This is what you have to understand as regards to the dialogues. I think today's we have 5 dialogues and 1 monologue. Well, first one is point. OET Zoom session is the point or the subject or the focus or the concept. Okay, and problem is poor registration, poor attendance. Okay, reasons discussed. What are the reasons discussed? First reason, no notice given, not properly publicized. Second reason, many sessions available. Third reason, not aware of the importance. So this is a structure of all the dialogues. Maybe they have different concepts, different topics, but this is the structure. It can be reasons or there can be solutions, anything. But then this is the structure. This should be in your mind. So as soon as you get into those 15 seconds, golden seconds, you have to assess for these things. What is the main problem or the concept being discussed or explained? Then how it is solved, or what are the reasons given, or what are the solutions provided? Those things. Hope it is clear for you. Okay, para dialogue structure. The dialogue structure is this: point, topic, sentence. So the main idea is being presented in the question as well as in the answer. Main idea or the gist. Second one, as I said, explanation will be there. Supporting sentence. That will be the explaining the main idea. What is the topic, concept, main concept that will be being explained. Third step is evidence. They might give some example or illustration of the main idea. Then fourth one, link, which means conclusion. Maybe they speak something and they put a contrast or they give a contrast expression and say something else. So that becomes the answer. Conclusion. Okay. Now we will get into the real question. Now just read this. Just read this, please.
You hear a dentist discussing booking problems with the hair receptionist. What has caused the problem? Option A, an error with the booking system. Option B, a double booked appointment. Option C,
Sorry.
a lack of communication.
So just try to find out the stem words. As I said, here who is speaking? Dentist. He is discussing. There is somebody else, okay? There is a dialogue, right? Booking problems. What is the concept or issue? Booking problems. Who is he speaking with or discussing with? Receptionist. These are the main things you have to analyze in the few seconds that you have, for 15 seconds. What has caused the problem? Means they are asking for a cause. What is there is a problem? What is the problem? Booking problems or registration problems. As I said, we have poor attendance or registration for OET Zoom session. Here, what has caused the problem? That's the question. So you have to find out a cause. First cause, an error with the booking system. Second cause, a double booked appointment. Third cause, a lack of communication. Do you see that structure so clearly given? So when you listen to the audio, listen in this context to identify one of these three should be the answer. So which is the answer?
You hear a dentist discussing booking problems with her receptionist.
This is a 15 seconds to read the question and the answer options.
Hey Kieran, Mr. Lau just mentioned that he'd tried to reschedule his appointment yesterday, first online, and then when that didn't work, he called up. But apparently he couldn't reschedule. Any idea why?
I wasn't working yesterday, but let me check the notes. So Lana left a note about the call. She says that Mr. Lau wanted to reschedule, but we didn't have any other appointments this week after 3 p.m., which is the only time he could make. He asked if he could make an appointment next week, but his procedure was marked on our system as urgent, so she had to make it in the same week. The system wouldn't have let her reschedule it any later. She wouldn't have had the authorization to change that. Still, she should have discussed this with you at lunch or at the end of the day, because then you could have decided whether it could have been postponed for a week.
Yeah. In his circumstance, it would have been fine to reschedule at a slightly later date. We should prevent something like this from happening again.
You're right. I'll talk to her about it tomorrow, and I'll send out an email to everyone else so that they're aware.
Okay. Did you get the idea?
Yeah.
What is the answer?
Lack of communication.
Lack of communication.
Okay. Okay. Let's assess how it is. So, dentist discussing booking problems to receptionist. Three things you have to notice immediately as you go through the question and the answer options in the 15 seconds. What has caused the problem? They are asking for a reason. Okay. There is a problem and 3 reasons explained, which is the one. Okay. So the topic is reschedule his appointment. You know, the audio begins with you hear a dentist discussing booking problems with a receptionist, which is already here in the question statement. So you have read it. So immediately you can, they will say again, they will repeat it here in the audio. Okay, what you had in the question statement. Now you say reschedule his appointment. Okay, so reschedule is the issue. That is the key word being repeated again and again. You see here, reschedule, couldn't reschedule, again reschedule. That's what I said. The key word will be repeated again and again. Reschedule his appointment. It was not done. Couldn't be rescheduled. Why? Reason has to be said. So they are saying he asked if he could make an appointment next week, but his procedure was marked on our system as urgent. So she had to make it in the same week. The system wouldn't have let her reschedule it any later, means than the next week. She wouldn't have had the authorization to change that. Still, she should have discussed. Still, she should have discussed. The still is the key word here. So all these things are saying, as per the rule, there was no possibility of rescheduling. But then it still says, in spite of all that, she should have discussed this with you at lunch or at the end of the day, because then you could have decided whether it could have been postponed for a week. Now you see, yeah, that is being emphasized, saying next response. Yeah, in this circumstance, it would have been fine to reschedule at a slightly later date. So rescheduling was possible. But why? An error with the booking system, they don't say anything about the booking system at all. There is no error with the booking system. And double booked appointment, nothing to speak about. They are not speaking anything. A lack of communication. She should have discussed, she should have communicated. Then we should have found out a solution. That's why I said the gist is the reason. They don't clearly speak about lack of communication, but you should have told me, then I would have found a solution. If I tell you that, it shows that you did not communicate it to me. Otherwise, I would have found a solution. For example, today many were not able to attend because there was rain and lightning. If you would have communicated me, I would have postponed today's session to tomorrow. So the problem is you did not communicate to me, not the rain or the other things. Okay. Hope that is clear to you. Okay. Yes. Question 26. Please read.
You hear a doctor discussing chest X-ray information with a medical student. What is the doctor explaining? Option A, the order for discussing results to the patient. Option B, the information to include in patient notes. Option C, how to correctly examine the patient's condition.
Okay. Now you see a doctor discussing chest X-ray information with a medical student. Doctor is there. A chest X-ray information is the issue here, or the concept here, or the focus of the conversation, and with a medical student. What is the doctor explaining? Now you have to understand the gist. What is he explaining about? The order for discussing result to the patient. Does the audio speak anything about about discussing the results of the X-ray to the patient? That's what you have to understand in the 15 seconds. Now, we fast read. Then the second one, the information to include in patient notes. Does it speak about does he explain about how to write the patient notes? And third one, how to correctly examine the patient's condition. Does it speak about any examination of patient's condition? So these are the three options.
You hear a doctor discussing chest X-ray information with a medical student.
Hey, Dr. Yan, we've got the x-rays back from Mr. Regis in bed 8 from this morning.
Great. Can you document them in the notes?
Do you mind showing me how to write the interpretation properly?
Of course. Make sure you put the patient details. Full name, date of birth, patient number, and home address first. Then put the hospital and ward, date, and time. Make sure your name is on the document too. Include the indication for the x-ray like hemoptysis or dyspnea before documenting your interpretation. Now, I use a simple mnemonic to make sure I don't miss anything. A, B, C, D, E. Airway, trachea, carina, bronchi, and the hilar structures. Breathing, lung fields and pleura. Cardiac, heart size and heart borders. Diaphragm, position, shape, and costophrenic angles. Finally, everything else, the mediastinal contours, bones and tubes or devices. Make sure you document everything clearly using this system in the notes.
Okay. Any idea?
Option B. Option B. Option B.
Yeah.
Option B.
Did you
To include.
Yeah, did you notice how they repeated the patient notes in different ways?
Yes. Yes.
Continuously they were repeating, right? See here. See can you document them in the notes? Document means patient notes. Document them in the notes. Question itself says, what is the answer? Can you document them in the notes? Then do you mind showing me how to write the interpretation, which also means notes? Put the patient details, again indicates patient notes. The document again speaks of patient notes. Then documenting your interpretation again speaks of the patient notes. And finally, everything else, document everything clearly. Again, it speaks of patient notes. So the synonym or the synonymous of the patient notes is being repeated again and again, whereas you have nothing to do with the patient. There is no word patient is never mentioned. Patient condition is never mentioned, right? the first option and third option. That is discussing results of the patient, examine the patient's condition. That's not given at all. Nothing is mentioned about it. So here, from the very first question, you have to listen to this question as well. Then you have the thing being repeated again and again. Same thing. So keywords are very important. Just listen to the keyword or the synonym being repeated again. So immediately you can confirm what is the answer. Yeah, hope that is clear for you. We'll go a little faster because there are no beginners, I believe. Yes, please read. By the end of reading, Lily Mole will play, okay?
You hear an ENT surgeon talking to a colleague about cochlear implants. The surgeon is explaining that cochlear implants, option A, transmit voices more clearly than other noises. Option B, emit a variety of sounds into a microphone. Option C, restore hearing in deaf people.
You hear an ENT surgeon talking to a colleague about cochlear implants.
We implant an electrode array which looks like several small wires made of a platinum iridium alloy into different regions of the cochlea. These metal wires conduct the electrical impulses generated from the microphone, which picks up sound from the environment and sends the signals to the electrode array through a transmitter. There's also a speech processor between the two that filters more important sounds so that the patient can hear people talking rather than other sounds.
Right, okay. So does this restore hearing to normal levels?
No. With the current technology, we're giving deaf people a good representation of sounds from the environment and help to understand speech. After surgery, patients undergo therapy to relearn the sense of hearing. Not everyone benefits from the device to the same extent.
Right.
Sorry. Any idea?
A father transmit voices more clearly than
Okay, let's check why it is. Okay, you said transmit voices more clearly than other noises. Okay, let me check. Yeah, how does it work? Yeah, see here, descriptive paragraph, topic cochlear implants. What is it? How does it work? What is it? What is its function? Okay, so this is called descriptive paragraphs. I believe I have explained to you about 6 types of paragraphs, right? Maybe many of you have attended it. So if you would, to know the nature of the paragraph, it helps you to understand where the answer is easily. So this is a sort of descriptive paragraph. Topic is cochlear implants, and first part says of the paragraph begins saying what is cochlear implant. Then it says how does it work, then what is its function. So you see, generated from the microphones. Here you see, emit a variety of sounds into a microphone. Generated from microphone is quite opposite to into a microphone. They are just opposites. So that is wrong. And filters more important sounds so that the patient can hear people talking rather than other sounds. You see, voices, noises, sounds, the synonym sounds is being repeated several times in this paragraph. And again, you have the question, right? Okay, so does this restore hearing to normal levels? So restore hearing in deaf people? No, categorical no. So immediately, you know, it doesn't restore. With the current technology, we are giving deaf people a good representation of sounds from the environment. That is similar to paraphrasing of more clearly, voices more clearly, transmit more voices more clearly. Means we are giving deaf people a good representation of sounds from the environment. So this is the paraphrasing. So this answer is being again re-emphasized in the second sentence. First they says filters more important sounds so that the patient can hear people talking rather than other sounds. As I said yesterday, that is a clear paraphrasing of transmit voices more clearly than other noises. So exactly the paraphrasing is given here. And when they asked, does this restore hearing to normal levels? They says no. With the current technology, we are giving deaf people a good representation of sounds from the environment. So this is like repeating the same thing, emphasizing it, saying no, it doesn't restore, but it does this. Is that clear?
Yes.
Yes. Yeah, please read. And soon after that, Lilimol will play the audio. We'll go faster. Yes.
You hear a GP talk about diagnosing type 2 diabetes mellitus. Why should a fasting plasma glucose test be booked in the morning? Option A, the patient will need to attend an 8-hour appointment. Option B, the test will need to be carried out twice. Option C, to allow the patient to eat during the day.
Okay, now Lilimol, 1 minute. Can you predict this answer? You know what is glucose, fasting plasma glucose test, right? Without the audio, can you predict the answer? If you have heard it earlier, it's okay. Otherwise, is it possible for a health professional to predict? Why should a fasting plasma glucose test be booked in the morning? Does it require the patient will need to attend an 8-hour appointment? Do they need to be in the hospital for 8 long hours?
No.
Yeah, the test will need to be carried out twice. The test will need to be carried out twice. Do you need to carry out the fasting plasma glucose test twice?
No.
No. So ultimately, to allow the patient to eat during the day, because 8 hours of fasting is required. So take it in the morning so that during the day they can eat, because you have fasting 8 hours in the night. And actually, you don't require any knowledge, any audio to answer such type of questions that we call predicting the answers. And once you go through these options and to allow the patient to eat during the day, if that is the answer, if these two are not the answers, this should be the answer, right? The patient will need to attend an 8-hour appointment. We don't have 8-hour appointment in the hospital for just for fasting plasma glucose test. The test will need to be carried out twice. Normally, we don't require, only they say to confirm it second time it has to be done, but then normally it is not the condition. So when these two things are not the correct one, the other one must be the one. Let's listen and confirm it.
You hear a GP talk about type 2 diabetes mellitus.
Hello, I'll be covering the diagnosis of type 2 diabetes mellitus. So there are 4 methods that we can use. The first is a fasting plasma glucose test. This is our preferred diagnostic test, as it's easier to carry out, often more convenient, and costs us less than the other 3 tests. It helps to try and book these appointments in the morning, as the patient has to refrain from eating for at least 8 hours before they can take the test. Normal fasting blood glucose will be between 70 and 100 milligrams per deciliter. A value of over 126 milligrams per deciliter indicates a diagnosis of diabetes. Bear in mind that this test should be carried out twice to confirm a positive result. The second method we can use is to measure the average glycemic load over the past 3 months.
Okay. See? So type 2 diabetes fasting plasma glucose. It helps to try and book these appointments in the morning, as the patient has to refrain from eating for at least 8 hours before they can take the test. So it's your prediction is exactly right. And this test should be carried out twice to confirm a positive result. It doesn't say the same day, same appointment, you have to do the 2 tests. It can be later as well, right? After another day, you have to fast and you can take the second test that day itself. That doesn't mean, normally we don't do it. We'll visit second time. If we have to be confirmed, we'll take another fasting plasma glucose test. That is clear, no? So prediction can work a lot. That's why I said the 15 seconds are known as the golden seconds. Try to predict, then while listening, you will understand it better. Okay, please read.
You hear a dentist talking to a patient with a chipped tooth. What does the patient want to know? Option A, how long the procedure will last. Option B, when her next appointment will be. Option C, what her different treatment options are.
Okay, just listen to the audio. So how long the procedure will last, when her next appointment will be, what her different treatment options are. What dentist, patient, talking, chip tooth. Patient want to know something. Just what is the person concerned with?
You hear a dentist talking to a patient with a chipped tooth.
So we've talked about different options, and it seems like a veneer would be the best treatment. Given the cost of the procedure, are you happy to go ahead?
It's quite expensive, but I definitely need to get it fixed. Will it stay put?
Veneers tend to need replacing every 10 to 15 years, so they are a long-term solution. It will certainly be more durable than composite bonding, and it will look more realistic too.
Oh, okay. That's great. And is there anything I can do to extend their lifespan?
Well, you need to maintain good oral health. You know, brushing, flossing, regular checkups. You should avoid brushing your veneer too hard, as it could cause damage.
Okay.
Do they speak anything about the procedure?
No.
About next appointment? Nothing. Nothing about appointment at all. What are different treatment options are? Where as soon as they start, they are saying the best option, which means see different options. What are different treatment options are? See, in the very beginning, you hear a dentist talking to a patient with a chip tooth. So we have talked about different options. I said no topic sentence gives the key concept or the keyword. So different options, the clue is there, and it seems like a veneer would be the best treatment. So when they are speaking about the best, the scale is being used there, best treatment, that also says that is the answer. Okay, given the cost of the procedure, are you happy to go ahead? It's quite expensive. It looks like when you listen to it, looks like it's very expensive. I don't want it. But they are saying it's quite expensive, but I definitely need to get it fixed. Though it is expensive, I want to go through it or opt for it. Will it stay put? Veneers tend to need replacing every 10 to 15 years, so they are a long-term solution. It will certainly be more durable and look more realistic. Everything speaks about more. All the comparison and scale says that is the answer. Okay, and that's great. Means I agree with that. And is there anything I can do to extend their lifespan? So they're speaking about the treatment options, nothing else. Because how long the procedure? Nothing they speak about the procedure. When her next appointment will be, that's also not being spoken of. Appointment is not spoken of at all, right?
Yes, Father.
Yeah, please read.
You hear a podiatrist talking to a patient with fallen arches. The patient explains that his treatment, option A, will need to continue for some time. Option B, has become too time-consuming. Option C, is not improving his condition.
Okay. Patient explains that his treatment will need to continue for some time. Yeah, please, audio.
You hear a podiatrist talking to a patient with fallen arches.
So, you say you're experiencing foot pain. Are you wearing supportive shoes?
I'm wearing appropriate shoes, and I'm also wearing orthotics that should be helping, but I'm still experiencing pain in my feet. Sometimes they feel a bit numb too.
Right, okay. And you mentioned that you've been given some foot exercises to do?
Yeah, the physiotherapist I went to showed me those. At first I thought they were helping, but now I think I'm as bad as I've ever been. Is there anything else we can do?
See, the contrasting words clearly give the answer. You see, I am doing something, treatment. What is the treatment? Wearing appropriate shoes. I'm also wearing orthotics that should be helping, but I'm still experiencing pain in my feet and also a bit numb. See, but it is not improving, but it's not helping. Again, they say, yeah, the physiotherapist I went to showed me those, and at first I thought they were helping, but now I think I am as bad as I have never been. I'm as bad as I have never been, means my condition is very bad, which means I'm not improving. So they don't speak anything about will need to continue the treatment more or has become too time consuming. He doesn't speak anything about I'm wasting my time or taking too much time, nothing of that sort. So whole gist you have to understand, saying that in spite of all this experience, each treatment he is highlighting and saying, but contrasting expression. Then he says, I'm still experiencing pain. It has no improvement. There is no improvement because of this particular procedure. Or the next one, physiotherapist taught me all these things. I'm doing all those things. But now I think after doing all these procedures, I am as bad as I have never ever been. I am not now better, but I am worse. Is that clear? So this is what known as gist. And clearly they explain it, emphatically explain it. So by practice, definitely you have to listen to the audio repeatedly. As I said, at least one week you have to listen to the same audio so that you get the accent and you understand the audio. Do you need to visit any of the slides? Otherwise, I will stop sharing.
That is 28th question.
28. This one, right? What was the doubt here? You see, diagnosis, this was what we predicted, no? Fasting plasma glucose test. What is the reason? Why should a fasting glucose test to be booked in the morning?
I could not understand that. It helps to try.
Without reading any, listening to the audio or script, reading the script, why? What is the reason? Well, 3 reasons are given. Why should a fasting plasma glucose test to be booked in the morning? So 3 reasons. One, patient will need to attend an 8-hour appointment. Do you think when a patient comes for a fasting plasma glucose test, the person has to spend in the hospital 8 hours? Attend an 8 hours appointment means spend 8 hours in the hospital. Do you think just a glucose test needs 8 hours?
No, Father.
No. The test will need to be carried out twice. Do they carry out twice in the same day?
Actually, in this audio, they are saying that bear in mind that this test should be carried out twice to confirm a positive result. By hearing that sentence, I thought it's so.
Bear in mind that from your general understanding, do they do the test fasting plasma glucose test twice a day to confirm, or they call you another appointment?
No.
See, there is no meaning in doing it twice. Taking 2 times blood in the same day. Is there any meaning?
No.
Is there? No. Again, you see the modal verb. I did not explain these basic things because I thought this test should be carried out. Should be is not must be. You may carry out.
Recommendation, that is.
Yeah, recommendation. So I don't explain those things because you are not beginners. So even otherwise, this cannot be. The test will need to be carried twice. Normally you don't carry out twice on the same day to confirm. So both of them, from your general knowledge, it is just eliminated. So the third one is to allow the patient to eat during the day. So you have to listen to the audio just to confirm third one. Third one is the answer. First and second is clearly eliminated. So there is no other option.
Yeah.
Okay.
Okay, thank you.
Clear, no? Yeah, that should is very important. Yeah, you can take. Maybe the difficulty is because you are not able to understand the audio. That's the difficulty, I believe. I say. Otherwise, things are very clearly and very slowly they speak out. It's not once. Almost every audio they repeatedly say, re-emphasize the answer. And most of the options, 2 options are not given at all. When it is not at all given, there is no confusion. So any idea what are the difficulties? Many of you were messaging me and telling me B part is challenging. I got only 2, I got only 3. What's your challenge?
Because Father, from here we are explaining it is so we can understand easily. But once we are doing in the real life in the YouTube, it is so difficult.
No. The thing is it's not understanding. I told they always make a difference. This is knowledge which I am giving you, not the skill. Understanding is not the skill. You have to, what I suggest always is take the same script. If you have taken the screenshots without looking at the screenshot, try to analyze and find out why this is so. And speak out at least in Malayalam, if not in English, why this is the answer. You argue with yourself. First second. You argue with yourself, shout at yourself, then have a dialogue with yourself and have reasons why you eliminated first one or second one or third one. Listening step by step. As you know, I just want to remind you about the steps of listening. Make sure that all these steps are observed in your practice. Especially the beginners should observe these things in your practice. First step is to do the test under exam conditions. Exam conditions means you will not be taking more time. You'll set the alarm for the time and take the test, the whole test under the exam conditions. Step 2, refer the key and identify the mistakes. Once you have completed your task. Maybe you have not completed all the questions, but within the time, that's fine. Whatever you are not completed is considered as a mistake, or you don't get that score. So refer the key and identify the mistakes. Step 3, record your score on self-assessment form that we have given you. And step 4, listen to the audio again and try to identify the answers and related strategies. You'll be listening to the audio again to identify the answers. Though you know them from the key, now you have to understand, find out whether you understand the context and the answer. And as regards the self-assessment form, you are supposed to send it to me, but send it to us by the end of the week. And only then we'll be able to guide you and assess your performance. And step 5, listen to the audio plus read the script and mark the answers and highlight the related strategies. This is multitasking. 3 tasks you are doing together. You have to listen to the audio, at the same time hold the script in your hand and go through the script, read in your mind, and mark the answers and highlight the related strategies. So you should be listening, reading, and writing together. This needs a bit of practice from your side. Otherwise, you'll find it very challenging during the exam. Step 6, detailed analysis of the audio and script to understand the strategies involved. Keep the audio, listen to the audio, and analyze the audio as well as the script to understand the strategies involved. You know which are the strategies. And step 7, analytically listen to the same audio repeatedly for a week or so. Same audio, whereas you can do other practices, other audios and other tasks every day, but then try to listen to one particular audio that is the task of Monday, maybe one particular audio throughout the week, so that will help you improving your competency. And there are other things like script writing for the beginners. If you want to summarize, listen to and write the script or summarize what you heard, all those things can be practiced, depends on each one's competency, but advanced aspirants may not require those things.